So we have an example of an adult spine and an infant spine. So I'm going to show you an adjustment on the adult spine about the force that we do and the difference. So again, we're motion palpate the spine. This would be a neck adjustment, looking for where the joint gets stuck, a fixation, and you impulse into that. And that cavitates or pops the joint, restores normal joint motion. More importantly, takes pressure off the nerves, helps the nerve system function better, which is, remember, controls and coordinates the whole body. Infant spine, same idea, but the force is about 1/10 of that. Just find the joint that's stuck, light impulse into the area, maybe about 2-3 pounds of pressure. That's it. Gets the same result. They're mostly cartilaginous, great movement, doesn't take a lot of force, highly effective.